Good afternoon, dear students. You must have seen such a headline at least once in the past 3 or 4 months about a doctor who's brutally attacked by angry patients or their bystanders. And you can see that this trend has been going up over the years. So there is a high chance that some of you, or maybe all of you, might be faced with such an aggrieved patient in your future career. So how can you counsel an angry or aggrieved patient? You must have seen some patients getting aggrieved during your clinical postings, right? So what were some of the reasons they were angry? Yeah, longer waiting time, unhappy with the outcome. There are different factors, like patient factors. You shift the patient from one department to another, you give them a lot of diagnosis, they come to you with watering, you post them for cataract surgery. All this can aggrieve the patient. And we tend to get irritated when we are having any sickness, right? So any chronic pain or illness, and some patients just normally have a low anger threshold. Doctor factors are also very important. Most importantly being poor bedside manners. How you talk to the patient, how you behave in front of the patient, this is very important. Inadequate communication about the risks associated with any procedure, about the chances of outcomes. So all this, if not discussed properly, can lead to an expectation gap from the patient and can lead to an unsatisfactory outcome and an unhappy patient. Systemic factors are also very important, like longer waiting time, billing issues, high cost of treatment, physician burnout. So all this can aggrieve the patient. Now, there is a 6-pronged continuum, starting from a calm and non-threatening patient, which is an aggrieved patient, to a physically threatening and a physically violent patient. What is the importance of this? We must catch the patient when they're aggrieved so that they don't progress along this continuum to become angry or even aggressive. So catching the patient and intervening early is as important as diffusing a bomb timely. What is worse than having to deal with one angry patient? Yes, that patient agitating all the others in the waiting area and having to deal with a lot of angry patients. So imagine you have an aggrieved patient. You quickly isolate them, seat them, give them a cup of water, take them to a room, listen to them patiently, let them talk about their grievance. You can acknowledge and empathize with them. Madam, what is your grievance? Tell me about your complaint. Yes, ma'am, I understand how this is feeling for you. I understand that this is very difficult for you. Who is this? Any cricket fans here? MS Dhoni. What is his nickname? A clue for you. Captain Cool. So, like our Captain Cool, we must remain calm and cool even in the most tense situations. We should clarify the facts, but avoid confrontation or blame. Do not blame the patient. They have a grievance. Do not try to defend yourself or justify yourself, because this is just going to make matters worse. Reassure them. Ma'am, I understand that this is what caused the delay. I assure you that this is a one-time thing. It won't be repeated from our side. I sincerely apologize from my side. Now, find some point of agreement. You can agree that their complaint is a valid one. And you can offer solutions, or better yet, you can ask them for their idea of a solution. Sir, how do you think I can handle this? What do you think I can do for you? And find some small ways to make concessions, because this is going to make the patient very happy. Finally, be on the lookout, because if the patient blows up, your safety is your priority. Listen calmly, do not interrupt them, let them talk, maintain a safe distance, and get security assistance immediately if needed. Document everything. Document that you've explained all the risks, to whom you've explained to, and follow your institutional protocol. Most hospitals will be having a grievance redressal committee. So homework for today, find out what your institutional protocol is. Should we always wait till the patient is aggrieved to intervene? No, we can avoid such a situation. Most importantly being good communication. The longer chair time that you spend at the OPD, it is as important as the time you spend with the patient in the theater. So a proper pre-op counseling, including all the risks, all the complications, all the chance of outcomes, all the different alternatives, all this must be explained. And it should be included in the clear and informed consent that you get signed from them. Train all the staff in the hospital, starting from the registration counter where the patient first comes to the billing. All staff must be trained to quickly spot an aggrieved patient and intervene early, and put in a transparent system for handling complaints. So, thank you, dear students. Like Bill Gates has said, our most unhappy customers are our greatest source for learning. Handling a difficult patient is always a challenge, but I hope this class has helped you equip for what lies outside this classroom. Any doubts?
Ma'am, I'm in a hospital and there is an aggressive patient who's coming right at me, and I don't know what to do. I am feeling very threatened. I want to let all my staff know. What should I do, ma'am?
So first and foremost, what you have to see is that you have to make sure that you are safe. So make sure that
Is there any code, ma'am?
yes, there is code white in most hospitals. You can ask you might be having an OP staff, you can ask them to announce code white. This will alert the security personnel. You will get a security staff, an MSW staff to help you deal with such a situation, and it will also alert them that such a situation is going on in this hospital in this particular floor. Anything else?
Teacher, I am very hungry. I want to go.
Sure, I think this is the last class for today. You can have your food soon. You can come prepared with your doubts for the next
Commission
class.
mandates this many hours of class for licensing your, degree. So you need to, unfortunately, bear with us.
Otherwise, court will put you.
If we don't give her food soon, she'll become angry and agitated maybe. Okay, come prepared.